think it's been a pretty busy summer for all of us, and maybe you've put off some of those doctor's appointments, but maybe this is one you shouldn't. I want to bring in Andrew Reinhardt. He is with Wasatch Medical Clinic. So, Andrew, we're talking about erectile dysfunction. I know it's a topic that makes a lot of people cringe or get very, very uncomfortable, but it's very common.
It really is. There are so many men struggling with ED, and I think a guy struggling thinks he's the only one, or maybe he's too young and healthy. You are more normal than you think. Nobody wants to take the pill and deal with the side effects, but you're right. This can happen to anybody.
So, Andrew, we see you just about every week, and we've talked about this a lot, but let's talk about when they come into your clinic, who are the doctors that they're going to see, and how does it work in the treatment?
Well, we do a consultation and an exam to screen every patient, and this is with an MD. This will be a medical doctor who will basically make sure that your erectile dysfunction is a blood flow problem and not something else, which occasionally can happen. He'll do a blood flow ultrasound to test that. And then you can determine if the treatments on our wave therapy are a good fit for you or not. If the pill is working great for you, I'd say keep doing it. But if you don't like the side effects or the lack of spontaneity, our technology could be a good fit.
And if that technology is a good fit, the acoustic wave therapy, tell them how it's very, very painless. It's very easy.
It is. It's totally non-invasive. The technology is placed on the skin, and gentle pressure waves open up the blood vessels. It's backed by 40 clinical studies saying it can reverse erectile dysfunction. It treats the root cause. It gets the blood flowing properly. And thank goodness there are no pills involved.
Which is so nice. And you mentioned in the beginning that people often think I'm too young, I'm too healthy, this can't happen to me. But you guys have seen a huge array of an age of men that have come through your doors.
We really have. They say 2/3 of men with ED do nothing. They do not seek treatment because of that stigma. We treat everybody, and we've seen it all. The worst thing you can do is nothing, because the erectile dysfunction typically does get worse on its own.
And then it affects the relationship, and that can cause all sorts of other problems, and who wants problems in their life, right?
Yeah, that's exactly right. It doesn't just affect the man. He has a significant other. This affects the relationship. And in my opinion, ED can cause stress, depression, and anxiety, and affect overall sense of happiness.
And you're going to help them with their first appointment getting in. It's going to be a really good offer for them.
That's right. That exam and the blood flow ultrasound that we mentioned with the doctor, we're doing it free. Plus a gift that produces powerful results in the bedroom. You'll love it. It's worth hundreds of dollars. If you're struggling with ED and ready to put an end to it, call us now. It is all totally free.
Great. Thanks for helping the guys out, Andrew.
Thank you.